Well, as you can see, so far, we've talked a lot about the brain. And in listening to Dr. Jennings speak, I'm thinking that maybe we should have changed the words a little bit. Maybe we should have started with the brain, biblical technology, and then modern medicine, going in that direction. Because I think we're building a good case here when we talked about healthcare, that maybe we could say that healthcare actually starts with our brain and our thoughts. This afternoon, we're going to be a lot more practical in some of the things we're talking about. We've sort of brought forth the theory, and I think that epigenetics is just very fascinating. How all the things affect our genes that we don't even know. You know, how we think, how we sleep, how we drink, the different chemicals that come into our life, the different emotions we have. All of this has untold effect on our chemistry, and it's now, I think Dr. Jennings showed well that there's strong science behind this. And what's so exciting to me is all the science always correlates with the Bible. And that is very exciting in building faith. You know, when you see that, you know, there's data behind everything that's said, and that's very exciting. And when you can take this information on the brain and biblical technology and bring it into modern medicine, it even makes it more exciting. So I'd like to tell people that, you know, I went to school, medical school at the University of Texas, San Antonio, and then in internal medicine in Delaware and cardiology at the University of Kentucky. But the best textbook I've discovered is the Bible. And as we go back and listen to those truths, we go back and find the chemistry that explains it. And then instead of giving medical prescriptions, we can give biblical prescriptions. And it's just very exciting. This afternoon, I'm going to start talking about prolonged exposures. Well, a prolonged exposure is simply something that you have a lot of. Let's talk about some prolonged exposures. Some people have prolonged exposures to the sun. If you have prolonged exposures to the sun, what happens? Skin cancer, right? Sunburn, skin cancer. Prolonged exposure to the sun is not good. It causes cancer. Prolonged exposures to cigarettes. What does that lead to? That's right, lung cancer and a host of other disease. So prolonged exposure to cigarettes is not good for us either. How about prolonged exposures to bad food? Yeah, diabetes is one. We also know that people that eat high blood pressure is another one. We also know that people that eat lots of too much animal products, that leads to cancer. So prolonged exposure to certain foods can raise the chance of developing cancer. We know that prolonged exposures to, these fatty foods can also stimulate breast cancer. So prolonged exposures to bad food is good. How about estrogen? Prolonged exposures. Anyone think they have prolonged exposure to estrogen? Some people do. Did you realize that all of us who carry extra weight, the endocannabinoid system, adipose tissue, guess what it makes? Estrogen. Men that carry extra estrogen have less libido, lower testosterone levels. Women that carry extra weight have extra estrogen. That's what increases the risk of things like breast cancer, diabetes. So a prolonged exposure, people don't think prolonged exposure to weight hurts you, but prolonged exposure to extra weight has a chemical consequence. Oxidative stress. Well, what's that? Well, that's a fancy word. Everyone's heard of oxidants and antioxidants. Well, these are substances that cause free radicals and electrons moving around. Well, when oxidation starts occurring in the vascular system, bad things happen. Heart attacks, damage to the inside lining of the blood vessels called the endothelium. Different types of food cause oxidation. I like ice cream, but ice cream is one of the worst products that cause oxidative stress. The combination of sugar, the combination of eggs and that, it just causes oxidation in the body. So if you're going to eat ice cream, eat some antioxidants with it, some blueberries, or put some strawberries on top and try to counteract it a little bit. So things that cause oxidation can hurt you. Prolonged exposure to that. Well, How about prolonged exposure to things like stimulants? Diet pills. We've seen those a lot, but almost all the diet pills out there, unfortunately, have stimulants to them. There's all sorts of stimulants in our society. Too much caffeine can be a stimulant. Too many medications. There's some medications that act as stimulants. Too much exposure to the media can act as a stimulant. Too much just data. Today might be a stimulant. Too much exposure for some people today. Too much exposure to all this information can be a stimulant. That's a prolonged exposure. But prolonged exposures can cause problems. How about medications? We've never studied medications for 50 years. They've never been studied for a long time. I'm dealing with the medication now that's been around a few years called the statins, cholesterol-lowering medications. And I'm not sure what the prolonged exposure to that's going to be. We know that it can make the muscles, there's some proteins in the muscles, the funny names, Rick, Rack, and Row, but it can deplete some of those muscles and cause myositis. We don't know for sure what prolonged exposures are going to be. So when I talk to my patients about medications, I tell them, listen, I use medications to treat symptoms. And as a doctor, I sort of specialize on risk management. Doctors treat symptoms, but we're all healers. When we make someone laugh, when we serve somebody, when we make them feel good, we're changing their chemistry just as well. We're going to talk about that later. So prolonged exposures to medications, prolonged exposures to noise, prolonged exposures to a lot of bad things can cause a chemical consequence, and some of them that we don't even know about, some of them we have very little control of in our society. Which brings us to things, we've been talking about the brain today. What about prolonged exposures to things on our brain that we don't even think about? Feeling guilty all the time. Well, that's a prolonged exposure, and I think we're going to find out from Dr. Jennings later what that might do to our brain cells. We've already talked a little bit about prolonged exposures to being fearful, being scared all the time. Well, could that be a good thing? What about in our society, we see prolonged exposures to violence. Prolonged exposures, a lot of people now are into pornography. Prolonged exposures to pornography. Prolonged exposures to anything that we weren't designed to handle could cause a brain problem, which is subsequently going to cause downhill problems that we're going to talk about. So these prolonged exposures, no matter what it causes, has chemical consequences. For instance, we could be stressing our body with nutritional stressors, eating the wrong type of food. But also, we can have good stressors. Prolonged exposures to good things can actually help us. Good nutrition makes us better. Prolonged exposures to bad can stress us. We talked about hydration, something as basic as drinking water. When someone comes to me and says, listen, I really want to have a good diet. I said, listen, Rome wasn't built in a day, okay? Let's just start on simple things, like a relationship with God, ask Him to help, and let's do one thing first. And let's try to drink enough water first every day. Do that for a month and see if you don't feel better. And when they come better, we add another one. So other stressors that we can work on is weight. We've already talked about television and information overload. Some of us are working too hard out there. There's a balance between work and rest. Sometimes we can have relationship stressors. And remember, the chemicals that happen from bad relationships can be just as damaging as the chemical stressors from dehydration or not resting enough. If you have a bad relationship, we've talked about the abusive relationship, but any of those relationships we're going to find later on can have damage to the brain. And Dr. Jennings is going to talk about ways, we talked about the problem in the first half, but now we're going to talk about solutions in the second half. Ways we can identify problems in the brain and deal with them, like depression. Ways we can make our brain better. Active things we can do so we can actually come out. Because we know we have to, in order to find a solution, we have to recognize the problem first. And I'm afraid in this healthcare world, we're not really recognizing what the true problem is. So if you don't leave here with anything else, I want you to leave here saying, listen, the problem might be related to my brain. The problem might be related to stressors in my life, And the solution is not necessarily modern medicine, unless I'm having a catastrophe. So things that can stress the brain out that we don't even realize, some of you don't realize, we talked about televisions and bad movies. Some people are addicted to emails and going on the internet. I have patients that stay on the internet 4, 5, 6, 7 hours at a time. They stay so much that they don't move their legs and they have swollen legs and they get blood clots in their legs. Not to mention about what it can do to the brain. Selfishness. Remember, we were designed to love each other and serve each other. So a brain that's selfish all the time could be hurting ourselves chemically. Emotions, lack of sleep, all these are things that can hurt our brain, these stressors. So prolonged exposures to anything bad, there is chemical changes that happen. There's also changes that we talked about in our epigenetics that we're just finding out about that we can't even measure. Things that are passed on in our genetics for subsequent generations. That's when we talked earlier about 20% of our conditions might be genetic. Yes, it might be. But there's things that we can do if we have bad genetics. The animal studies have proven that if we have bad genetics, there's places we can go to start, so maybe we won't get this extra methyl group here or extra methyl group there that's going to trigger these proteins that are going to cause bad things to happen to us someday. The basics of stress chemistry is this chemical called adrenaline, epinephrine. When epinephrine goes high in the body, lots of bad things happen. And it's great if you have someone that you have to beat up or run from. That's great. You beat them up and you're done. The adrenaline goes right back down. But can you imagine one of these stressors, either mental or physical, that we've talked about, going on day in, day out, week in, week out, month after month, year after year? Guess what it does? The adrenaline, the cortisol, the inflammatory markers, all of those are just circulating in your body, causing lots of problems. When you make a lot of adrenaline, you don't sleep as well. We know that. You don't heal as well. You want to clot more, so the heart attack rate goes up. Your blood pressure rate goes up. Your ability to fight infections go down. And also, these chemical changes of chronic stress affects our epigenetics that we're just now learning about. If you think about our world, we didn't have a lot of these stressors that we had 200 years ago, did we? We are just adding on stressors year in, year out. Everywhere around us, there seems like they're adding more. And, you know, one of the things that's stressing me out is this election thing. That is really stressing me out. I'm tired of hearing about these guys doing bad things. It just stresses me out. So I just want to turn it off. Don't want to hear about it anymore. But you know what? If you sneeze in one room, in an hour, the whole world can know about it now. We weren't really made to know about everybody's business all the time. Some people, that stresses them out. So there's chemical changes when these prolonged exposures. And as we're exposed to these chronic stressors and these chemical problems, guess what happens? Sooner or later, a symptom develops. It might be weight loss if you're stressed out a lot, chest pains, shortness of breath, pain all over your body, fatigue, headaches. You might develop fevers, you might get palpitations, you might get joint pains. They say up to 80 to 90% of all doctor visits are made now because of stress in a life. And unfortunately, rather than get at the cause, traditional medicine treats symptoms, right? We treat symptoms. And a scary fact that I came about recently, that 80% of antibiotics written for upper respiratory infections are unneeded. Unneeded. And yet we inherit the risk of an antibiotic for a viral infection that is not helping at all. So we focus on treating symptoms. It's easy. If someone's not sleeping well at night, it's rather than get at the cause, see what's stressing the system, upsetting the sleep patterns, it's much easier for a doctor to write a prescription for a sleeping pill. If someone has acid in the stomach, it's much easier to write a prescription for an acid blocking medicine than get at the cause. Plus, if you don't get at the cause, guess what? They keep coming back for more, right? How about blood pressure? How about diabetes? I've never seen a medication cure type 2 diabetes. Never have. Never have. But there are some doctors, one of the doctors that I associate with out in California named McDougall, He works on getting at the cause of the problem, which is fat. Too much fat in the body, too much fat in the diet. He cures 90% of his type 2 diabetics. They don't take the medicines, they don't keep coming back. But traditional medicine doesn't seem to focus on that. So most of these chronic diseases, how about diseases of inflammation? You know, a lot of inflammation can be treated with lifestyle changes. So I look and I see patients coming in with 15 and 20 medicines, and traditional medicines really don't fix things. Sometimes it helps buy some time so they can learn about things. So traditional medicine does a lot of medications. Some of good traditional medicine also focuses on lifestyle, and we're hearing more about that. Eating healthy, exercising, resting, drinking water, doing all those good things. But today, I'm saying in this part, we're going to talk a little bit about some newer concepts in the way to change our chemistry. And these newer concepts come from changing our brain chemistry, changing the different parts of the brain that are working, turning down the amygdala, the limbic system, and turning on the prefrontal cortex and the parts that Dr. Jennings talked about, making those parts stronger. These newer concepts is concepts that have biblical principles, like resting. How many of us rest one day a week? And yet we talked about laws earlier. That is one law that was given to us from the beginning of time. You know, God didn't have health problems. He worked 6 and he took a day off, didn't he? How about rest at night? We were made to have good rest at night. When rest happens at night, the body has a chance to heal itself in many different ways. We talked about hydration. Just drinking water is a very powerful way that you can turn down your inflammation in your body, that you can give the brain some of the things it needs. You know, how many people really take in half of their body weight in ounces every day? 200-pounder needed 100 ounces of water, or until your urine comes out clear. How many people really do that? But these newer concepts we want to introduce today, we were originally made to be happy. Happy people have good chemistry. We've proven it in a few studies. There's a few Greek studies done, and men that have had heart attacks, they go into these laughing clubs. And when they laugh and laugh and laugh, they measure some of the endorphins, they measure their blood pressure, and something's good is happening in these laughing clubs. We were designed to be happy. We weren't designed to be sad. It's okay to be happy. The chemistry of happiness is good. I bumped into someone in the office the other day, and we were talking about this stuff, especially about diet. And they said, you know, I just can't eat this way because it just makes me a grumpy old man. And I said, well, you know what? I would rather have you eat some bad stuff, you know, be moderate about it, than be a grumpy old man. Because I think the chemistry of being a grumpy old man is worse for you than having this every once in a while. We see this chemistry of this term that sometimes people get called legalism. They get so worked up over stuff. But you know what? Happiness is important. Also, another thing that's important for our chemistry, even more so than taking a pill or having a procedure, is this treatment called service. We were designed to serve each other. When we serve each other, our chemistry improves. You know, we've seen this over and over and over in people that take care of people, that they get a blessing out of that. Well, this blessing can be measured chemically. When you're serving other people, whether it be just smiling at them or helping them out here or there or thinking good thoughts, when we're serving others people, we're bringing our bodies back into what we were originally designed to do, to serve the world, to take care of the animals, to do the things that God wants us to do. So acts of service are really acts of worship. When you've done them to the least of these, you've done it to me. So it's hard for people to say, you know, when you're serving your mankind, you're also in a state of worship. You're in a state of helping the world out. But when we do this, we find that the chemistry improves. And we're going to talk about how service might help depression, how it might help other health conditions. And also, a newer concept. And it's hard when someone comes into the office. They always want a prescription. But you know, say, well, why don't you serve some people? Or why don't you just be happy? Or why don't you just drink some more water? Or why don't you love somebody? Well, you know, this is easier said than done. It's much easier to put a pill in and change your chemistry sometimes and do this. And it's all easy to say up here up front. It's easy to say these things. But what does it look like? What are some practical things that we can give a person that they can take home where they can change their chemistry, change their epigenetics, change the parts of the brain that are activating? What are some things that can be done, and how did you make this happen? Theories are nice, but give me something practical, something that I can take home on, something that I can actually do to improve my chemistry, something I can share with my neighbor to make the world go longer. Not everyone can love everyone right away. Not everyone can be happy immediately. Not everyone can serve. Now, I will say this, everyone could probably rest right away. I think they can probably do that. If you can say no to your busy schedule. I had a fella come in from New York, and he had been to the Mayo Clinic and Johns Hopkins, and he had been bypassed 2 or 3 times. He's 42 years old, had a terrible genetic history. He works at a Fortune 500 company, and he works till 1 o'clock every night, 1 a.m. And I said, listen, why don't you, and he's having chest pain a lot, he's having angina. He's on all the right medicines. And I said, listen, John, why don't you just do this? Why don't you just go home at 5 o'clock for 2 weeks and call me back and tell me how you feel? So he said, I just rested and I had less angina. My blood pressure went down, I felt a lot better. I said, well, why don't you take it a step further? When was the last time you took a vacation? He says, well, I usually don't do that. And I said, well, I'm going to prescribe a vacation for you. He had a place in Wyoming that he could fly out to in his jet. So he went out there, did that for a week, and guess what? He called me back and says, you know what? I feel good, okay? A year or two's passed, and now he's decided he doesn't really need to work anymore, He says, listen, what's more important than my health? What's more important than I take care of a lot of people that are between 80 and 100. And I've never, ever had someone come to me and say, when I was younger, I wish I'd have worked harder and done more of this. They never say that. They say, I wish I'd have spent more time with my family. I wish I'd have spent more time going different places or experiencing different things. The grind, sometimes our culture has created the grind to be a major stressor. Now, is it important to be active and do things that's productive? Absolutely. Because we were designed to work. And that's another whole thing. People that work, that's good for their chemistry. People that don't work, that lay around all day, that's not good for your chemistry either, because you weren't designed to be that way. So inactivity in the brain and the body is a stressor too. So there's got to be moderation. But this gentleman that finally figured out that he was overdoing it, it was causing all these adrenaline, all this inflammation. Now he went to his doctor at Johns Hopkins and told him what I had done, and they said, listen, that guy's a quack. A quack. He doesn't know what he's doing. And he says, well, check my blood work out. Checked his blood work out. His blood pressure was better. His inflammation was better. He wasn't having as much chest pain as before. And so I don't know. Is that a quack? I don't know. I might not have all the scientific data yet, but we will get that in time. Dr. Esselstyn at the Cleveland Clinic is proving that these things occur, proving it through nutrition already. Well, the next step in cardiovascular disease is proving that this brain changes. Dr. Jennings might end up being a cardiologist yet. He might just not realize it. Since cardiovascular disease is number 1 in health problems, but it's number 1 not because of the disease itself. It's because of how you get to the disease. And that's where the brain is so intimately involved. And that's why we're having these things. So these newer concepts we're going to talk about today. And Dr. Jennings is going to come up in just a few seconds and talk about the body and brain and give you tangible things that you can take home today to avoid these prolonged exposures that are killing us, that are taking away our energy, that's also taking away our ability to have a healthy relationship with God. Sometimes these chronic stressors might be coming from friendly fire. It might be coming from your church. It might be coming from your doctor. It might be coming from your family. But you've got to identify where this is coming from. So I'm going to ask Dr. Jennings to come up here and get ready. And he's going to talk about what we can do to relieve our brains that are under distress. how we can change our chemistry to cut back on depression, anxiety, fear, anger, guilt, all this chemical and physical stress that cause all these symptoms of insomnia, depression, weight loss, pain. All these symptoms are leading to all these problems that we want to change our chemistry on. The old medications, the old way of medicine is not working. We want to talk about these new medications. We want to write prescriptions for love and happiness and service and rest and joy and peace and contentment and all these new things. But you know what? It's great in theory, but how do we get there? Well, I'm going to leave this part off with, we become like that we worship. We've already talked about how what we worship makes big changes in our bodies. And I think Dr. Jennings is going to bring up today how the things we worship change our brain. When we change our brain, we're going to change these chemicals that come out of our brain. We're going to change our symptoms. We're going to change our epigenetics. We're also going to change the diseases that we get. Can we eliminate everything for the brain? Probably not. But I dare say 90% of chronic disease, if we had our heads on right and our relationships on right, we would see dramatic results. Thank you.